Thank you so much, Speaker Bass, for that wonderful speech. We're in awe of the challenge ahead of all of us and you, and we're wishing you the best in solving the budget crisis, and it's very soon, next week, hopefully. Okay. As the next item on our agenda is a plenary panel. And as the panel takes the stage, which I'd like them to do now, I'd like to draw your attention to these note cards and pencils that you have sitting on your table. I think they're on your table. And if at any point during the course of the panel, please feel free to write down a question and raise your hand, and one of the staff will come and pick it up, so that once the panelists had a chance to deliberate, we're going to take questions from the audience, but basically we're going to do that through the questions that are on the cards. So think of some questions as the panelists go forward. And now I'd like to introduce our plenary panel moderator, Professor Dowell Myers. Dowell is a professor and also the interim director of our doctoral program at SPPD. In addition, he's the director of the Population Dynamics Research Group, the co-director of the new USC Center for the Study of Immigrant Integration, and he leads the ongoing USC California Demographics Futures Research Project. He's well known as a specialist in demographic trends and their implications for policy and planning. Professor Myers in that role has also been a long-standing advisor to the U.S. Census Bureau and is the author, actually, of the most widely read and widely referenced text on census analysis. And in March 2007, the Russell Sage Foundation published his newest book, Immigrants and Boomers, Forging a New Social Contract for the Future of America, which received the American Sociological Association's award for Best Book on Immigration. And in fall 2006, Professor Myers also was the recipient of the Haynes Award for Research Impact that was issued on the occasion of the Haynes Foundation's 80th anniversary. And in addition, he holds a PhD in urban planning from MIT. Now, of course, all of these accomplishments pale in comparison to the fact that he is one of the best harmonica players in the world, a great ballroom dancer, and a wonderful colleague to go cross-country skiing with. So please welcome my good friend and colleague, Professor Dowell Myers.
Well, thank you for those kind remarks, Dean Knott. Rest assured, I did not bring my harmonica. Well, good morning, everybody. It's really my pleasure to introduce to you today this panel of cross-sectoral experts who we've assembled to address our question, which is a challenging one, of how do government, philanthropy, and business contribute to building healthy communities. Now, our presumption is that in our schools that solutions to problems like this really require the cooperation from all the organizational sectors in our state and our nation to get effective solutions. You know, it may be fair to state, I think, simply put, that place matters. All the evidence shows that the place you live in shapes your health. And the idea of a healthy community really involves so many different factors all working together. Now, our panel this morning consists of true captains in their respective fields. Their full biographies you have available, I think, in your program, so I'm just going to introduce them very briefly. I'm going to start from my far right over here. Elise Buick is the President and Chief Executive Officer of the United Way of Greater Los Angeles. Randall Lewis is the Executive Vice President for the Lewis Group of Companies, Community Builders Extraordinaire. Diana Banta is the Vice President of Public Affairs for Kaiser Permanente Southern California region. And Gail Goldberg is the Director for the Los Angeles City Planning Department. Now, I have a set of questions to pose to each of you, and I'll give you each a chance to answer these. We want to keep, our time is very short, so we need quick answers so we have time for the audience at the end here to ask some of your questions that you'll write down on the blue cards. So this is such an exciting topic, and we all have a lot to say. Now, so here goes, let's just get going. So here's my question I want to pose to you first. The one everybody in the audience is most curious about. What is a healthy community? I know it's someplace it's perfect, where all the children are, as they say, above average, and no one ever misses a day of work. But really, I'm wondering, what are the key features? So you each give us your 1 minute definition. Elise, let's start with you.
Okay, good morning, everyone. For me, I think that I would say two characteristics. One is, it's really a question of access, that the residents of that community have access to affordable housing, to good paying jobs, to quality schools and healthcare. And then the second dimension, I think, is that the community is a mixed one. I think communities that we see that are the healthiest, they're diverse in terms of ethnicity, age, income, all the things that we want to see. So those are the two defining characteristics that I would remark on.
Okay. And Randall?
For us, we try to take a systems approach to health and a holistic approach to health. We try to look at the broadest definition of health, so all sectors of the population, but all ages from before birth even to the end of life issues. Health is physical health, of course, but it's a lot more than that. It's mental health, it's social health, it's environmental health, it's access to health care, it's transportation to health care. It's a whole system that you have to work on. So for us, you have to take a very broad definition of health, and you have to look at it in a systems approach to a healthy community.
Okay, great. And Deanna?
I think we used to talk about health as the absence of disease, and we're always looking for some miracle cure for cancer or for a vaccine that would prevent HIV. But if we go way back, we look at the remarkable changes in health for society have really come from good infrastructure, good water systems, sanitation systems, roads. And that prevented injuries, that prevented loss of lives. And we've seen just in the last decades where we've made significant strides in creating healthy communities by excellent public policy that keep us from smoking. And I think now that we're looking at what's the future and what's our present day, is to be able to integrate some of that public policy into dealing with issues such as obesity and the prevention of it by creating environments in which people can have access to healthy foods, can have the ability to walk in their neighborhoods without fear of physical violence in their neighborhood. So that's part of the equation of a healthy community.
Well, I agree with everything everyone said. I think as a planner, I think of a healthy community as a place that nourishes the people who live there, the people who inhabit that place. And when I say nourishes, I mean in all of the ways. Physically nourishes people by providing a clean, healthy environment, clean air, sustainable community, a place where people can walk, and that not only it is pleasant to walk, but it is useful to walk because there are things that make walking worthwhile. There are places to go. The place has to also nourish the people who live there, not just physically, but fiscally. It has to provide economic opportunities for the people who live there. Education, jobs, opportunities to take care of themselves. And then third, I think it has to nourish people sort of spiritually or socially. It has to be a place where people can congregate, get to know their neighbors, and see interesting things that spark, that thing inside of us all that makes us human.
Okay, well, these definitions would really apply in the 1950s too, I wonder, or would they not? We're in the 21st century, and Deanna already alluded to what we've learned about those issues. I wonder, as we move forward here, we're learning, we're getting better. I think we're getting smarter. So what would you say is like the one most important thing that we've learned recently about building healthy communities as we go forward now? What's the one most important thing? So we'll start again with Lisa.
Okay. Well, I think in the communities that we work with, we see that the one most important thing is the level of engagement that's happening. And, I think to use your analogy down the 1950s to now, what's exciting is that technology can really help foster that. And we're seeing that in all kinds of ways. But I think when residents really do feel empowered, that they are learning how to navigate systems and structures, and it may start off with a small thing, graffiti abatement, but as they start to take on that leadership and become more engaged and take care of each other, that's really been the one defining characteristic. And like I said, I think our hope is that through technology, we can even make that stronger in our neighborhoods.
Excellent, excellent.
I'd like to give 2 lessons on one sheet. The first I'll reference it, and that's that place matters. There's just been a lot of research that's come out that shows where you live affects the way you live in your health. And it could be things such as access to good food or bad restaurants. It could be where you're located. It could be, do you live in a community designed to promote physical activity? Do you live in a community that has a culture and programs that support wellness? So place really matters. I think that, and what we found on place is that what you do in the built community, if you're in downtown LA, you're probably going to need very different strategies than if you're in Santa Clarita or the Inland Empire, there's empty land. So you need different strategies depending where you are. The second lesson we've learned is just that prevention is always going to be cheaper than cures. There's never going to be enough money, especially in California, to solve things through cures. And it's also inhumane to make people wait to get sick to try to help the problem. So it's way cheaper to fix the problems up front.
Okay. Yeah.
I guess I'd say that what makes a difference is leadership, and we see that in Supervisor Mark Ridley Thomas, we see that in Speaker Bass, in terms of how they've approached the issues and how they've really integrated the community's voice in everything that they're doing. We have a series of issues that keep us from being a healthy society, but if you really go back to people and ask them what do they need as tools, they have the solutions as well. Why did Kaiser fund the oral health initiative that Speaker Bass talked about? Well, it's because on the community needs assessment, it was ranked right up there in terms of tremendous need. For years, we've been thinking that the mouth is not part of the body, that somehow the dentist takes care of that. And then we're puzzled to find that we have low birth weight babies being born. Why? Because their moms have infections of the mouth because they didn't get dental care. So it's all interconnected. And with leadership, we can look at these very significant issues, break them down, go to the community, and look for ways in which we can pull together the resources. And this conference is an example of that because it brings together government, corporations, as well as the university setting to be able to broker those relationships and to make sure that we're really being innovative. Now's our opportunity really to do that.
Wow. The learning I'm grappling with right now actually has to do with your question about the 1950s, I think. Because in planning, starting around that time, we started planning neighborhoods and communities in a very different way. And what I'm learning is that those neighborhoods that were planned for people are much healthier today than the neighborhoods we have planned since for cars. And that raises for me the whole question of technology. And it's sort of be careful what you wish for. And it reminds me, I just thought of a childhood book that was my favorite book. And for any of you who love cities, you must try to find a copy of Edith Nesbit's The Magic City, written I think in the early 1900s. It's a story about an orphan child who, in a lonely place, creates a fantasy little city out of bric-a-brac from around the house, and one morning wakes up to find that the city has grown to life size and this child is living in the city. And one of the rules of the city that never left me was, and there were rules in this city. One of the rules was about technology, even in 1910. And the rule was you could have anything that you wished for. But there was a special rule about machines. If you wished for it, you had to use it for the rest of your life. And I think that that to me has been a particularly sort of useful lesson as we are now trying to figure out how to turn the car from that thing that gave us freedom to that thing that is now imprisoning us.
Wow. It makes me think about something that my colleague David Sloan wrote that he taught me. David Sloan's a historian and an urban planner. And he wrote about early in the 20th century when we were fighting against congestion and all these overcrowded tenements. And that was the goal, was to, the health problem then was to get more air per person and to decongest the cities. And by God, we did it. And now the new problem is one of sprawl and automobile emissions, and it's paving the green fields around, sprawling. It's what we wanted.
Be
But now
careful what you wish for.
Yeah. So it is all relative, and we do have to learn. So these are excellent thoughts that you guys have put forward, and I'm sure the audience is writing notes furiously about what they want to ask. So let me just move to, I have 2 more questions I'm going to give you, and then we can give it back to the whole group here. So all of our sectors, public, private, nonprofit, have important things to contribute to these goals of a healthy community. And each of you works primarily in one of these sectors. So I'm going to put you on the spot. I have an idea here to asking you, so thinking outside your own sector, not inside, outside, what do you see that, from your perspective, are the ways that the other sectors can help you, your organization, address your goals? What do you want to get from the other guys? So let's put it on him. So let me start with Dion this time.
Okay. So I work at Kaiser Permanente, which is what is called an integrated health delivery system, fancy word for a health plan, hospital, and physicians all working in alignment. And we're a not-for-profit, so where we usually traditionally work will be in patient services and the delivery of healthcare systems. But where we want to partner is externally. And so that's part of what my job entails, is working with Elise. For instance, she had a fantastic conference yesterday dealing with emergency services and how we could respond as communities. I want to partner with the business community as well in terms of being innovative with working with government about approaches that might work. I'll give you an example. We were looking in the greater Los Angeles area about 3 years ago. We said, let's deal with some of the issues of obesity and Latino children in neighborhoods. How could we get them physically moving more and exercising more? And we started realizing that for many children, it's a battleground every day. They really don't have safety in terms of playing outside, or the playgrounds are not accessible to them. We started looking and realizing that there's swimming pools out there. And as we looked at it, that many of them were closed early in the season in the summer. We're blessed with great weather in September even, but we had to close these pools. And so we approached the city of Los Angeles and they said, we don't have enough financial resources to keep the pools open. Can you help us? And we said, sure, we'll provide chlorine, not too sexy, but needed. We'll provide for lifeguards. Well, what happened? With an investment of $1 million for 44 swimming pools in the city of Los Angeles, 8,000 children learned how to swim that summer. These same kids learned how to be junior lifeguards so that they can have a job later on. These are the same kids who are going to say, there's an ocean really close by. Maybe I can go to that with my parents, and encourage the parents as well to learn how to swim. Second year of that project, the Parks and Recreation Department came to us from the city and said, Kaiser, you've got nurses and dietitians and health expertise. Can you help us plan a better menu for our after-school programs? Can you help us plan a better menu for our summer programs? And so we did a training for 400 city staff members in fruits, vegetables, how to prepare an interesting menu. The third year, we partnered by bringing our educational theater program that Kaiser has run now for 21 years, and actually doing presentations on health themes for young children so that we could talk about ways in which they could eat broccoli and they could eat fruits and vegetables. So I see that as a dimension that we bring in all of our sectors together. We leave our egos at the door and we say, how can we help? What can we do? Doesn't have to be huge, be smaller in scope, but I'd like to see more corporate involvement, certainly, in terms of dealing with the issues here in our city and in other cities.
Okay, excellent. Who would like to take the question next? Gail?
I don't mind, I'll try to be brief. My biggest challenge right now in the city is it's an easy one, change the culture of planning in LA. I should be done, anytime. Change the culture of planning from a long culture in the city of planning the city sort of project by project to actually creating real community plans where communities know what's going to happen to them and buy in and want the plan, to real plans that are comprehensive and deal with all of these issues. I would love to get the public, the private, the developers, I mean, we have wonderful developers in the city, to the table to help us create these really wonderful comprehensive plans that establish all of these things in city policy that make it happen.
Well, Randall Lewis, he builds communities. He does that. I'm going to put it on Randall now.
Well, I'll talk to Gail afterwards. Planning LA is a difficult task, but I think we could use help in two different ways. The first would be from the academic side, and I really think in this arena, USC will turn to be the world leader in doing this kind of work. And we really need to know what to do, and we need to know how to build the economic case that says doing these things in advance is the right thing and it's the cheap way to do it. So the kinds of things we would want to know, we want to know from Gal who's living in our communities, because you can't really find the solutions till you know the statistics on who's living there. We want to work with architecture and with urban planning. We want to work with engineering. We want to work with gerontology. We want to work with communications to try to find all the elements of health and get the research that tells us what to do. And naturally, we want to work with the Lusk Center graduates to make sure that they're building the right communities as they go around the world. More than that research, the second part is the multi-sector side, and that is we would love to partner with the not-for-profit side and the government side, because no one sector can solve this alone. The problems are just too big. And what we've seen is each sector has its own resources, its own networks, its own connections, and its own agendas. And I think working together in a multi-sector approach, just as USC has put us together here, it's the right way to go. Last, I want to put in a plug for Kaiser. Of all the big groups, I think Kaiser is doing the very best job of trying to help create these communities where people can flourish and thrive. So thank you.
Okay, Elise?
I think for us, what we see, we know that we are blessed with good policy development in this region, but where we get stuck at times is the polarization that tugs at that policy on either side of it. So the successful models we've seen, the business community is an amazing resource, always with their financial resources, their human resources, having their employees be involved in civic issues is a big help to us as a sector. But I think also their willingness to roll up their sleeves and to get involved, and Deanna's a great example of that, of being on commissions and really learning the issues, but becoming our voice for that policy to get implemented. Because a lot of times, folks are saying, where's the business community? So we really need to ramp that up. I think on the governmental side, Mayor Villaraigosa's administration has been amazing at reaching out across sectors. And so as we're looking at housing plans and policies, a lot of nonprofits have access to engage residents. And so if we can build a public will that will shepherd those plans in, and I think we need to see that at more levels of government, that there's that outreach and that trust in the beginning, and a lot of times that hasn't happened. So it's been very refreshing because as Gail knows, we have a good plan, but to sell it to those neighborhood councils, we really have to be strategic about how we do it.
Okay, I've got one more closing question. I'm going to hold it. I'm going to go right to the audience questions right now. And it just, you don't need to all answer. I'm going to target this one to Elise. I think Randall already got into this a little bit. What role would you think that SPPD should play in creating healthy communities? What do you see in your perspective?
Well, the United Way in particular has had a great partnership with USC and with the school, and I agree with Randall. I think what we see is that we really need to be able to frame these issues to create public will, and I think to shortcut and find where models are working and how we can bring those to bear. So I think the research is important. I no doubt we've talked to you about looking at social forecasting and what that could look like. And I think one thing that's missing in this region, and I think to build on Karen's statement, I mean, with the term limits and the transients that we see in the corporate sector, there's a lot of short-term thinking. And so this school has been invaluable in being kind of an anchor. I mean, USC is not going anywhere. Your leadership in terms of helping us keep that long-term vision in front of our civic leaders and not making the short-term decisions that we seem to be kind of hamstrung by lately. So I think that is such an important role that the school plays.
Okay, here's another question. Public-private partnerships were once thought powerful, but they seem to have been reduced to public affairs programs. How can we rethink the public-private partnership and particularly given budget constraints, with some bold innovations? Which of you would like to take that on? Any answers? Deanna?
Well, I think it can be something that is very tangible in terms of a partnership, because it's coming from, as my example earlier, on Operation Splash. But it can also be, I know what we've been working on, for instance, is here in terms of asking the community what are the needs. Many have said that there is a lack of specialty care. We have community clinics, for instance, that are safety net partners in the community. They work with the County of Los Angeles, with healthcare systems, with hospitals. And in trying to serve the need of so many individuals that don't have the financial means, do not have health insurance, are not covered by programs, are undocumented, they've said they can cover primary care, but the difficulty is to find the specialists, the ENT specialists, the radiology components, etc. I think that we can have those partnerships. We had one recently in which John Wesley Health Institute in Skid Row was having difficulties in having some of the homeless there actually have access to x-rays. Why is that important? It's important because you want to screen for the potential for tuberculosis for people before they go into housing. It's also important just because so many of the homeless have never had access to health care. Well, in that partnership and talking with them, we were able to actually have our radiologists digitally read x-rays on a daily basis so that people can get access to care from where they're at. So I think there is a deeper relationship that we can forge. It's not just what you might think of a public relations type of approach. It's a meaningful intervention that we can do, and that we can do it from this public-private partnership.
Okay. I'll tell you, I got problems here. This audience is so full of good ideas. I'm trying to figure out. All right, here we go. So here's one. Where'd it go? I'm overloaded here. I can't decide. Okay, here's a simple one. Gail, it's for you. The Southern California region, for all intents, is a built-out region. And our region's focus has been on redeveloping the older communities. So, would you have any ideas about an example? Pick an example of one community that you think is an emerging community that is creating a healthy community. What do you know as an example?
Well, we're in the midst of doing 13 out of of the 35 community plans. So we're doing 13 comprehensive community plans right now. And the places I think that are most exciting to me in terms of real opportunity for change are some of the South LA communities, where the residents of the communities are so much more open to change, to improvement, to looking at the commercial corridors. And in this city, the biggest opportunities to really improve life is to improve the commercial corridors and really provide a better mix of uses, a safe environment where the adjacent neighborhoods can come, walk, and find services. So I think some of the South LA communities, certainly in Boyle Heights, I'm excited about the opportunities that exist in places like San Pedro, where the interesting character of the community really lends itself to developing a wonderful, small-scale, beautiful community. This is such a big, diverse city that we have an opportunity for all kinds of different, healthy, wonderful communities.
Well, you just tell us where to go, and we'll send our students here to do a project.
And I'll take your students.
Okay, we're gonna do that. Okay, next question here is, this is changing the scope a little bit. And the question is, how do we meet our two greatest needs? And the questioner's question is, to strengthen and invigorate our civil society and to build within our population a greater concern for others. So this is at a civic level, not a physical level. I don't know what you do.
I'd love to just start because I think community engagement is so critical, and it's so challenging in a city as large as this with 4 million people. So it's difficult to build citywide consensus, but it's not so hard to build neighborhood consensus. And our biggest sort of obstacle, I think, is public trust. And one of the things I've noticed as we go out to communities, to the extent that we do take partners that are not government to talk to communities, people who have perhaps a little more credibility than they think we have, it is a wonderful opportunity to begin to really engage the public, but you have to mean it. Don't go out there and ask people what they think if you don't intend to pay attention to what they think. I am so sick of communities saying, you've been here before and you never did what was said anyway. I mean, if you're gonna do it, mean it.
Randall?
I think if we're gonna get healthy communities, you have to work at the community level, just what everybody else has been saying. I think if you wanna get that civic engagement, it is gonna be at the community level. What we found in the Inland Empire has been really successful. We've been involved in some public-private partnerships. Like, there's a program now called Healthy Chino, Healthy Ontario, Healthy Rancho Cucamonga, Healthy San Bernardino County, and Healthy Riverside County. And what those do is they're public-private partnerships that are run by the cities. They do assessments of the resources and the challenges of each community. They try to get task forces in the community itself, and they try to get the civic engagement at the community levels. They've been a wonderful, wonderful way to build healthy communities in those two counties, and I think that's the best way to get people engaged at their local level.
I mean, I think the only thing I'd like to add is that, we do have some great foundations of movements that have been built in Los Angeles, the labor movement and all their success, the environmental movement and how those movements have come together on some things. So, I think there's opportunity there that we need to build on. The other thing I would say is I think all of us really need to look at, it's great that we now have the country talking about community organizing and civic engagement, and I can tell you, in a way, we're really thinking about how do we bring that organizing and engagement ability to our frame, and it's a different model. So we used to go to workplaces just to raise money, and now we're really starting to go to workplaces and educate people. I mean, I think one of the things we have to remember, and I am out there quite a bit, and I can tell you, is that people don't know that we are the homeless capital of the nation. They don't understand our dropout rates. I mean, their mouths literally drop, and all of us are living it every single day, but they're driving to their home and driving to work. So I think anything we can do to educate and offer them opportunities to volunteer but more importantly, how to become activated as part of the solution. And I think that starts to build that compassion. And what we found, many of you may know, we launched Walked In Homelessness, is that it's building compassion for people who have never met homeless people but want to help. And so I think we need to start to think about those things as we build that very necessary element of compassion and understanding for neighbors we may never meet.
I've got a couple of questions I'm going to try to combine here. This one says, public sector leadership was mentioned as a key to creating healthy communities. Given the diminished capacity of the public sector today, how can private sector, not-for-profit, non-profit participants lead these change efforts? Can the public sector adjust to following behind the other sectors? And then this other question is, the best purpose of private philanthropy has never been to fill gaps when government can no longer fund its mandated programs. What role do you see for philanthropy in public problem solving at this time of financial crisis? So I guess the question here is, are we restructuring the relationships between the sectors, given our financial situation, and what do you see happening? So, yeah. Give me just a 30-second answer with everybody.
I've worked in government most of my career and not in philanthropy, so I've just gone over to that in the last 4 years. And I think that we can pull that together. For many, many years, philanthropy has steered away from government, has felt like it should take care of its own issues. And we can't do that any longer. I think there is a nexus for us to be able to do that together. At the state, I had a $32 billion budget, yet we have tremendous needs that could not be dealt with. We can, through philanthropy, not so much as, I wouldn't approach it as in terms of filling the gaps, but it's really looking together with government and saying, where are the priorities and how can we together look at a new approach to doing that? You're going to hear from Bob Ross later today, and that's certainly something that the endowment, that the California Wellness Foundation, that other foundations locally are trying to do as well in partnership.
Well, I mean, I think there is, I hear, and I've met this gentleman from ARCO, and I hear about the glory days when, Log Took and ARCO, they really drove change in the community. So I do agree with you, Dow. I think that with corporate headquarters leaving and the differences we're trying to see in the corporate sector, how change happens in this region is changing. And I think we all need to be very conscientious of that. I think with the question about the public sector, we've seen philanthropy starting to drive some of that, and I think the biggest example probably has been on the homeless issue and on the healthcare issue. I mean, if you look at the King Drew situation, I mean, the philanthropic leaders are really pushing government to solve it, but they're also saying, we want to be a partner with you. And, I think as we look at our electeds, we need to make sure we're electing folks that have that frame and know how to work across the sector. So that's why Mark was elected with an overwhelming majority, because he has that track record of reaching across the sectors. And I think we have to be very conscientious of that.
Now, I have another question that just came in that fits in nicely here. I'm going to launch this one to Randall. In times of intense fiscal constraint, how do you balance long-term and large-scale planning for healthy communities with the urgent need for improving health among individuals? So, yeah.
It's a tough question, but I think part of it is just to think, how can we allocate the resources in the most efficient way? And we've talked about out-of-sector and multi-sector, but I think one of the things we need to do as the business side and the philanthropy side is work with some of the elected side to say, look within your own sectors and how can you allocate resources in a different way. Again, I know the two counties we deal in, the cities, a simple word from a supervisor or a mayor or city manager, someone say, I care about health and it matters, look into this, is enough to make dramatic changes. So I think what we have to do is say, we're spending a lot of money on health, but are we spending it in the right way? Because I think we could get some pretty big returns on investment, just being smarter.
Okay.
Can I toss in something?
Please.
I'm development of those policies and the adoption of those policies can clearly be guided and led by other sectors. In this kind of an economy, for me, it's the best time to do long-term planning, because communities are a lot more open to sitting down and talking about the next 10 years when they're not so busy fighting every project that's being proposed in their neighborhood. I mean, they're not as busy with that. And so they're more open to looking, to the long term. And I also want to say, I think that this is such a crisis that I think it is going to force all of us, public, private, all of us, even government, to really look at the structure of our organization. And I hope the city of LA takes advantage of this opportunity to really look at how we do business and maybe make some fundamental changes.
Now, just to add into what Gail said, I know Chino, Ontario, and Rachel Cucamonga are all going through an update of their general plans. And as they're doing this, they're looking at their general plans not as zoning guides, but as operating models for their cities for the next 20 years. And it's interesting that in all three of those communities now, they're going to have a health element that will either be number 1 or number 2 on their priorities. And so it's at that policy level, by getting just, again, a nod from a mayor to say, I want a health element, that then sets the policy for the next 20 years.
I can add to that too. I think what Randall's also saying, I mean, make a big difference if you have policy changes, again, at a very individual basis. So farmers markets in Watts, first one was opened in the last 40 years, just this past year, makes a difference where people can have access to healthy foods. Having school policies that prohibit high-density caloric junk food, in the schools makes a difference. So it's not always about spending money, it's about revisiting issues, looking about where can we make a difference in these changes, and being brave and taking that on, because, that's the kind of changes we need. We now need to look at how do schools work with federal assistance to create opportunities to have safe routes to school, so that more kids can actually walk to school and get some further exercise.
And having a policy for the schools to say, let's partner collaboratively so those swimming pools can be open in September, or the gymnasium or the libraries can be open after hours. It's at the policy level where decisions can be made that will save money, so other money can be spent in a better way.
Okay, well, I got 3 final questions now. We're in the home stretch here. So now I'm going to give you one of my big ones. In the 1950s, this is from the audience, in the 1950s, LA had the Committee of 25 that provided vision for the city and could mobilize the city for action. What form or forms can and should play this role in LA today? How do we get on the same page, gang? That's the question.
Well, I think one of the things that we need to do in the city is that we set up a structure with charter reform for neighborhood councils. And then we haven't done very much to support it. We don't help to really educate them. With all of our talk about empowerment, at least from my perspective, I don't think that we have truly, invested the time and energy to help them be really effective change agents in terms of the whole city. But that is an infrastructure that allows us to go down to the grassroots level. And I think it's an important infrastructure that we need to develop, because if we don't, it will develop on its own, and it's another one of those things that, without the help and assistance and support to make it a productive effort, it can really become a force that does not lead to the kind of productive change that we need.
Now, at least the United Way has tried to do something along these lines, I know. And you probably learned how it doesn't work, or how it could work better. But tell us, what do we do to make this really be a driving force as we go forward here?
Well, I think what we're saying is we really have to look at institutional anchors across the sectors. I mean, I think that's what you're sectors that they're institutional anchors, the United Way, the Chamber, the California Endowment. So it's like, I think those are the models that we're starting to see where we all need to be talking about the issues that are facing this region: education, housing, whatever it may be. The media is a big issue. From that three-pronged filter of all those sectors and learning about this together. I mean, I think that is what I worry about is in the past even, and Dow, you know this better than anyone, you have people who are setting policy for populations they don't understand. And so I think the fact that we have business leaders and civic leaders that are willing to learn about these populations and what this region is going to look like is a good step. But I would say it's a new model change, and we're all learning, and we're having to build that trust and relationships across the sectors. So it's not as clean, I guess, as 25 leading CEOs just getting around a table and waving a wand. So it's a little bit dirtier.
Yeah.
Well, I wouldn't want to go back to the 1950s. I mean, we
Good answer.
didn't have a diverse population as we do now. We had 25 CEOs deciding on their own, out of touch with their communities. I'm not so sure there's one forum. I think we've had some wonderful, good examples of people coming together, but there needs to be multiple opportunities to do that. The neighborhood councils, the voice of an individual going to a city council meeting, all of those, I think, have to be part of it. And the fact that we're more reflective of our greater population in terms of our elected officials, in terms of our CEOs, in terms of our participation in the corporate sector as well, I think is a very good thing, in which you bring more people to the table, better ideas for potential solutions.
Well, we're getting to the end of our panel, and there's one driving, burning question that came out of the audience, which I'd like to have each of you answer just really quickly. But how can the students of USC School of Policy Planning and Development help you get your job done? They want to know. So,
Can I start?
go ahead.
This is the biggest, diversest city I know of in the entire country. LA is the last great unfinished American city. And we have problems all over the city that can be solved with creative, innovative solutions. If your folks want to work in communities, communities are receptive to innovative solutions to their neighborhood and community problems. And when communities identify what they are, having students who are bright and creative help come up with creative solutions to help not the whole city, that neighborhood. And if it works, great, we take it to the next neighborhood.
All right, Deanna, what do you say?
Well, I've worked with a lot of people that are in the audience, Harry touched on it, David as well, a lot of research that has come out of USC. So I say to the students to participate in those classes, to look for opportunities in which they can have real life examples that they're working on solutions in the community. I welcome that. I think that all of us in the private sector and in the not-for-profit sector welcome that opportunity for students. And I'd also say for the students, push the agenda in terms of ask for forums on health reform. That is the topic really that we, I think, need to address in terms of the changes for a better, healthier community.
All right, Randall.
Do you think, I know a lot of cities would welcome an intern, so anyone who wants to be intern in the Inland Empire, call me. And I love what you said, and it's work to push the agenda. I think would really be great.
Students are good at that. And Elise.
Well, I would agree with Gail. I mean, I think this is the greatest civic lab in the nation, and I think too often we look outside of Los Angeles for models we can import in. And I think the students here helping us to identify what's working, and in this region, it's always about taking things to scale. So I think your creative ideas, your energy about how we find the things that are on the ground working here, there are many, and helping us think through how we take things to scale. And the other thing I would just say in closing is that, I think we really need to look at the issue of equity. We are one of the most economically segregated regions in the nation, and that is a trend that is happening across our nation we're going through economic recovery, how do we look at equity issues and building that fabric tighter?
So maybe that's your closing thought. My final question for you all is, what is your one greatest wish going forward for the next 5 years? And Elise, yours is it addressing equity?
That is, and I'd like to add to that, there's a lot of conversation right now about infrastructure, and I don't think we're having enough conversation about human infrastructure. And, I think this mentality that Randall mentioned about, we don't do enough to intervene, we're not preparing our human capital, and I hope that that's my wish, that we can start to change the conversation.
Okay, and Randall?
I think for me, it would be to set up more community-based programs that were targeted to the needs of the individual community. Because one of the benefits is it builds the human capital too, and it utilizes the human capital.
Okay, yeah.
I'd start out with our new president signing into law the legislation that would expand access for health to children through the SCHIP program. So we have right now 6 million kids on that, 4 million without health insurance. I'd start right there. And then I would move that certainly in the next 5 years that we see health reform and universal health access in the United States. Taiwan does it, Germany does it, Japan does it, why can't we?
All right. Bravo.
Yeah. I think in the next 5 years, I want to have the planning department produce real holistic community plans that communities have bought into, real consensus plans that really address the whole range of issues that make a community healthy. I think LA needs to know what a real plan looks like.
I get the final wish, which is that these 4 experts, all of their hopes and dreams come true.